Have you ever experienced persistent stomach pain or discomfort? You might think it's just indigestion, but it could be something more serious. Millions of people around the world suffer from an infection caused by a bacterium called Helicobacter pylori, or H. pylori for short. H. pylori can lead to several digestive problems, including gastritis, ulcers, and even stomach cancer. In this video, we'll delve into the world of H. pylori, exploring its causes, symptoms, diagnosis, and treatment options. From how it's transmitted to the latest advancements in treatment, this guide will equip you with the knowledge to protect yourself and your loved ones. Whether you're experiencing digestive issues or simply want to learn more about this prevalent bacterium, this video is for you. Join us as we uncover the secrets of Helicobacter pylori and empower you to take control of your digestive health. Helicobacter pylori is a spiral-shaped bacterium that infects the stomach lining. It's estimated that over half of the world's population carries this bacterium, often without even knowing it. H. pylori can silently reside in your stomach for years, causing damage without producing noticeable symptoms. This infection is a global health concern, particularly in developing countries where sanitation and access to clean water are limited. The impact of this infection is significant, as it can lead to chronic gastritis, peptic ulcers, and even increase the risk of stomach cancer. We'll discuss the causes of H. pylori infection, how it spreads, and the factors that increase your risk. Finally, we'll delve into the available treatment options, including antibiotics and lifestyle changes, to help you understand how to combat this silent threat. Let's start by understanding Helicobacter pylori. This corkscrew-shaped bacterium burrows into your stomach lining. It disrupts the protective mucosa. This leads to inflammation and gastritis. Untreated, it can cause ulcers and increase cancer risk. Understanding H. pylori is crucial for prompt treatment. What makes H. pylori particularly fascinating, or perhaps alarming, is its ability to thrive in one of the most hostile environments in the human body, the stomach. The stomach's acidic environment, designed to break down food, is lethal to most bacteria. So how does H. pylori survive? It produces an enzyme called urease, which converts urea, a waste product found in the stomach, into ammonia. Ammonia neutralizes the surrounding stomach acid, creating a tiny, more hospitable environment around the bacterium. This ability to neutralize stomach acid allows H. pylori to survive and multiply in the stomach lining, establishing a chronic infection. The longer the infection persists, the greater the damage to the stomach lining and the higher the risk of developing complications like ulcers and even stomach cancer. Understanding this survival mechanism is key to comprehending how H. pylori causes such significant health issues. The discovery of H. pylori's role in stomach diseases was groundbreaking. Doctors once blamed stress and diet for ulcers. Barry Marshall and Robin Warren challenged this belief. They found H. pylori in stomach biopsies. They proposed it caused ulcers. Their findings faced skepticism. Marshall ingested H. pylori to prove it. He developed gastritis and cured it with antibiotics. This earned them the Nobel Prize in 2005. Their work revolutionized stomach disease treatment. Understanding how Helicobacter pylori spreads is crucial for prevention. This bacterium is highly contagious, often passing from person to person through various routes. The most common mode of transmission is the fecal-oral route. This occurs when tiny amounts of infected feces, perhaps from contaminated hands or surfaces, make their way into someone's mouth. Imagine not washing your hands thoroughly after using the restroom and then preparing food or touching your mouth. Another route is oral-oral transmission, which involves contact with infected saliva. Sharing utensils, drinking from the same glass, or even kissing can spread the bacterium. In some cases, H. pylori can also be transmitted through contaminated food or water, particularly in areas with poor sanitation. Knowing these transmission routes can help you take steps to prevent infection. While anyone can contract H. pylori, certain factors can significantly increase your risk. Living in crowded conditions with poor sanitation is a major risk factor. This is especially true in developing countries with limited access to clean water. Growing up with an infected family member increases your risk. Children often acquire the infection during childhood. Early exposure can lead to chronic infections. Other factors include family history of stomach cancer and low socioeconomic status. Lack of access to clean water in early childhood is also a risk. Understanding these factors can help you take proactive steps. Awareness and preventive measures are key to reducing the risk. One of the most challenging aspects of Helicobacter pylori infection is that it often doesn't announce its presence with clear warning signs. Many people carry this bacterium for years, even decades, without experiencing any noticeable symptoms. However, when symptoms do appear, they can range from mild and easily dismissed to severe and debilitating. The most common symptom is a dull or burning pain in the upper abdomen. Other common symptoms include bloating, a feeling of fullness, even after eating small meals, nausea, and frequent burping. These symptoms, while common to other digestive disorders, should not be ignored, especially if they persist or worsen over time. While some individuals experience mild and intermittent symptoms, others may develop more severe manifestations of Helicobacter pylori infection. As the bacterium continues to irritate and damage the stomach lining, it can lead to the formation of open sores known as peptic ulcers. These ulcers can form in the stomach, known as gastric ulcers, or the upper part of the small intestine, known as duodenal ulcers. Peptic ulcers often announce themselves with a sharp, gnawing pain that can be intense and persistent. This pain may radiate to the back, worsen at night, and disrupt sleep. In severe cases, peptic ulcers can bleed, leading to symptoms such as blood in vomit or black, tarry stools. If left untreated, ulcers can perforate, creating a life-threatening complication that requires immediate medical attention. While Helicobacter pylori primarily affects the digestive system, its impact can extend beyond the gut, manifesting in seemingly unrelated symptoms. This is because H. pylori infection can trigger a chronic inflammatory response throughout the body, affecting various organs and systems. One surprising symptom associated with H. pylori is unexplained iron deficiency anemia. This type of anemia occurs when the body doesn't have enough iron to produce red blood cells, which carry oxygen throughout the body. H. pylori can interfere with iron absorption in the stomach, leading to iron deficiency. Other non-gastrointestinal symptoms that may be linked to H. pylori include chronic fatigue, unexplained weight loss, skin rashes, headaches, and even neurological problems. While these symptoms are not specific to H. pylori infection and can be caused by a variety of factors, it's essential to consider H. pylori as a potential culprit. Especially in individuals with persistent or unexplained symptoms, H. pylori should be on the radar. Diagnosing a Helicobacter pylori infection is like solving a medical mystery. We need to determine whether this tiny bacterium is lurking in your stomach lining, silently causing inflammation and potentially leading to more serious problems. Fortunately, several diagnostic tools can help us uncover the truth. The approach to diagnosis depends on several factors, including your symptoms, medical history, and risk factors. Your doctor will consider these factors and recommend the most appropriate tests to confirm or rule out an H. pylori infection. One approach is blood tests, also known as serology tests. These tests detect the presence of antibodies, proteins produced by your immune system in response to H. pylori infection. A simple blood draw can reveal whether you've been exposed to the bacterium in the past. Another widely used diagnostic tool is the urea breath test, a safe and non-invasive procedure that takes advantage of H. pylori's unique ability to produce ureas. During the test, you'll be asked to swallow a capsule containing a small amount of urea labeled with a special carbon atom. If H. pylori is present in your stomach, it will break down the urea, releasing carbon dioxide that's absorbed into your bloodstream and eventually exhaled through your lungs. You'll be asked to breathe into a special bag before and after swallowing the urea capsule. These breath samples are then analyzed for the presence of the labeled carbon dioxide. A higher than normal level indicates that H. pylori is present in your stomach, actively producing ureas. The urea breath test is highly accurate and is often the preferred method for diagnosing active H. pylori infections. This test provides a clear and reliable diagnosis. While blood tests and breath tests provide valuable information, sometimes a more direct approach is necessary. This is where endoscopy comes into play. Endoscopy allows your doctor to visualize the inside of your digestive tract. The endoscope has a tiny camera that transmits images to a monitor. You'll be given a sedative to help you relax. Small tissue samples, called biopsies, may be taken during the endoscopy. These biopsies are examined for H. pylori bacteria or damage. Endoscopy with biopsy is the gold standard for diagnosing H. pylori. This method provides a definitive diagnosis and guides treatment. Once Helicobacter pylori takes hold in your stomach, it's unlikely to go away on its own. Without treatment, this persistent bacterium can lead to chronic inflammation, ulcers, and even increase the risk of stomach cancer. The good news is that H. pylori infection is treatable, and successful eradication of the bacteria can significantly improve your digestive health and reduce the risk of complications. The cornerstone of H. pylori treatment is a combination of medications, typically including antibiotics and acid-reducing drugs. Antibiotics are used to eliminate the bacteria, while acid reducers help create a more favorable environment for healing by reducing stomach acid production. This approach, known as triple therapy, has been the gold standard for many years. Triple therapy typically involves taking 2 different antibiotics, such as amoxicillin and clarithromycin, along with a proton pump inhibitor. While antibiotics and acid reducers form the foundation of Helicobacter pylori treatment, lifestyle changes and dietary modifications can play a supportive role in the healing process and help prevent recurrence. One of the most important lifestyle modifications is to quit smoking. Smoking weakens the stomach lining's natural defenses, making it more susceptible to H. pylori infection and hindering the healing process. If you smoke, quitting is essential for the success of your treatment and for your overall health. In terms of diet, there's no specific H. pylori diet. However, certain foods and beverages can irritate the stomach lining and worsen symptoms, especially during the treatment phase. These include spicy foods, acidic fruits and juices, caffeine, alcohol, and processed foods high in sugar, salt, and unhealthy fats. Helicobacter pylori, if left untreated, can have serious health consequences. Peptic ulcers are a major complication, causing pain and bleeding. Chronic H. pylori infection can also lead to stomach cancer. It's classified as a Group 1 carcinogen by the World Health Organization. Knowledge is power. Understanding Helicobacter pylori helps you take control of your digestive health. H. pylori can lurk silently, causing symptoms like pain, nausea, and bloating. Talk to your doctor about testing and early detection. Prevention includes good hygiene and hand washing. Please like, share, and subscribe to our channel for more informative videos.